Good morning and good afternoon, dear colleagues. I hope you all hear me well. My name is Melanie Nichols. I'm a technical officer for the Division of Prevention and Health Promotion in the WHO Regional Office for Europe. And I'm pleased to welcome everyone joining here today for the launch of this policy brief, Food Taxes for a Healthy Diet, Time for Action, developed by the WHO Regional Office for Europe with technical support of the Centre for Health Economics and Policy Innovation at Imperial Business School, London. So as we are just starting, we will take a few minutes for everyone to log in. As we are waiting, just allow me to go through briefly a couple of minor housekeeping items. Thank you, Elena. The webinar is offered today with live interpretation in Russian. So to enable this feature, please look for the interpretation icon on the bottom of your Zoom interface. Secondly, throughout the webinar, please submit any questions you may have via the Q&A function in Zoom. We have a dedicated Q&A session towards the end of the program, where we will address as many of the questions as time allows. Please note also that the webinar is being recorded, and the recording will be made available after the event. Thank you. So now let me briefly outline today's program. We will begin with opening remarks from Dr. Gundo Weiler, the Director of the Division of Prevention and Health Promotion at the WHO Regional Office for Europe. Following that, we have 3 presentations and a panel discussion featuring experts from across the region. We will then conclude with an audience Q&A session. So without further ado, it's my great pleasure to hand over to the virtual floor to Dr. Gundo Weiler, Director of the Division of Prevention and Health Promotion, for our official welcome and opening remarks. Thank you, Gundo.
Thank you, Melanie, and good morning and good afternoon, esteemed colleagues, partners, and stakeholders. On behalf of the new Division of Prevention and Health Promotion at the WHO Regional Office for Europe, I am pleased to welcome you all to this webinar for the launch of our latest product, the policy brief on food taxes for a healthy diet, time for action. This policy brief is the result of a fruitful collaboration between experts from the Imperial Business School in London and the WHO Regional Office for Europe. We would also like to acknowledge the strong technical input from our member states, including Portugal and Spain, and importantly, from the Joint Action on Preventing Non-Communicable Diseases. At the moment, the Regional Office is finalizing the second European program of work for the years 2026 to 2030. Promoting healthy diets and addressing non-communicable diseases were repeatedly highlighted as a key priority during consultations with member states and other stakeholders. As you know, the World Health Organization is also undergoing a transformation. And during the prioritization exercises carried out as part of this process, addressing NCD risk factors and prevention has consistently been identified as an area that must be protected. Therefore, our division will continue to strengthen its work on upstream policies and will support our member states in developing, implementing, and evaluating these policies. When we talk about addressing NCD risk factors or promoting healthy diets, we must emphasize that population-level approaches, such as taxes on unhealthy food products and subsidies for healthier options, are important and effective interventions. In fact, taxes on sugar-sweetened beverages are included among the WHO best buys for addressing NCDs. But in our region, where we are struggling to halt the rise of obesity, focusing only on sugar-sweetened beverages is not enough. With this in mind, we developed this policy brief, which presents the current evidence on the use of fiscal policies to influence the food environment at a broader scale. More and more countries are joining the dialogue on food taxes and taking policy action on foods beyond sugar-sweetened beverages. Member states face very difficult choices in their budgets, while healthcare costs continue to rise. They are looking for new resources and new sources of revenue. At the same time, policymakers are sensitive to and often reluctant to increase the cost of living burden on consumers. So what can we do to reorganize our taxes and subsidies to achieve multiple goals? How can we align them in a way that generates revenue while also protecting health and environmental objectives? These are some of the questions we will be discussing today. We are joined today by colleagues from Ministries of Health and Ministries of Finance, including some of you who are our focal points for the surveys on SSB and alcohol taxes. Thank you for participating. We trust you will be able to continue this dialogue in your ministries, governments, and other national policy-making forums. We hope that this policy brief, one of the early introductory documents on the topic, will advance this dialogue, bring more member states and stakeholders together to learn from each other, inspire academics to generate more evidence, and explore both the actions currently being taken and new policy approaches. I once again warmly welcome all the speakers and participants to this discussion, which brings together diverse perspectives from different sectors, including finance, public health, and consumer protection, with one shared goal: to understand what is feasible in the European region to promote healthy diets through taxation. I wish you all a productive and insightful session. Thank you, and back over to you, Melanie.
Thank you so much, Gundo, for those remarks. I'll now hand over to my colleague, Dr. Kremlin Wickramasinghe, Regional Advisor for Nutrition, Physical Activity and Obesity, who will set the stage by outlining WHO's policy priorities for improving nutrition environments. Kremlin, the floor is yours.
Thank you, Melanie. Thank you very much, Gundo, for that opening. I hope my slides are visible and you could hear me well. Thank you, Gundo, and thank you to all the speakers and our collaborators from the Imperial Business School, Professor Franco Sarsi, Joint Actions, member states, for being here with us today. I will try to give a little bit more context following Gundo's opening. And we think that when we talk about NCDs and it looks like my, is that better now, the slides? No? Okay, sorry, I'm not sure why. I will try to share again. I get a message saying that this is not in the correct mode. Let me open the presentation first. How is it, Melanie, now?
Perfect now. Thanks, Kremlin.
Thank you. Dear colleagues, yes, so I think we know non-communicable diseases are one of the leading causes of deaths in the WHO European region. There is cardiovascular disease, cancer, diabetes, chronic lung diseases. But if we look at what are the risk factors for the burden of NCDs in our region, we know dietary risk, both from diet, but also obesity. They are among one of the top risk factors that we need to tackle. And obesity is going to be the single most cause of disability in our region as well. So if we want to improve health and well-being, improving diets, addressing obesity is going to be very important. At the moment, around 1 in 4 children are living with overweight and obesity, and nearly 60% of adults are living with overweight and obesity in our region. More importantly, if we look at over the last few decades, the increase of overweight and obesity is exponential, and this is the similar story for children, adolescents, and adults. So across the population, we see this increase, the increasing trends, and we are struggling to hold the rise of obesity, which is our target. I will share a few slides from statistics from our Childhood Obesity Surveillance Initiative, show the current status among primary school children, one very important section of our population. If we ask primary school children or from their parents, do they eat fresh fruits every day? It's only less than half of the primary school children's parents say they eat a fresh fruit every day. Less than 35% say they consume vegetables every day. And almost 1 in 3 children consume soft drinks more than 3 times a week. And these are some of the statistics. And we know that obesity is associated with many conditions, cardiovascular disease, mental health, cancer, much more. And if we want to address these big priorities in our region, we had a cancer EU beating cancer plan. We are expecting a CVD action plan. We know mental health, addressing obesity is important for all of those conditions. WHO has produced many guidelines to help countries to improve diets or populations to improve diet. They are focusing on different aspects such as sugar, fats, salt. And we have also produced best buys. What are the most cost-effective interventions to improve diets? And that comes as reformulation policies, front-of-pack labelings, etc. And we had taxation on sugar sweetened beverages there. Then one of the main barriers to best buys is politicians and policymakers may think these policies may take 10 years, 15 years to see impact. That's why WHO Europe worked to do a review and identify which intervention have shown measurable results less than 5 years within one parliamentary cycles, and identify a set of 25 quick buys. We know that reformulation is one of the main areas, which is we see reformulation as a result of taxation, and these reformulation policies can give a lot of good results. If we look at in WHO European region about the implementation of policies, major nutrition policies, you can see that we only have around 58% of countries with good reformulation policies, or less than half of the countries with front-of-pack labeling policies. But most of these are voluntary policies. They are not mandatory. That means industry can choose to do them or ignore, and some of the aims of reformulation has not been achieved as set by the governments. So although we say 58% of the countries have implemented the reformulation policy, that doesn't mean they're mandatory or all the targets are achieved. And similar for front-of-pack labeling, does not mean all the foods have that. And food reformulation manual, country focus, we saw that we are talking about some salt, fat, and sugar reformulation manual to help countries to reformulate food. WHO has also look at sodium benchmark. That means what is the maximum level, what are the level of salt that is available in different food groups across the globe, so countries can see where can we benchmark each category, because we see salt level, huge variation across the countries for the same product by the same company. And benchmarking helps countries to identify, okay, for this product, we could benchmark at this level, no need to go above that sort levels. But when you look at SSB consumption and childhood overweight, we know there's many good examples. It's a very active policy area. Many countries are applying these policies, adapting them. And at the same time, we have published a lot of evaluation reports and case studies from our region about the SSBs. Our headquarters has also published a manual on sugar, sweet, and beverage and taxation policies. We have seen both from United Kingdom and Portugal, when they introduced the sugar drink tax, it has multiple benefits. Some of that is, of course, with the price increases, the demand may go down, but at the same time, we have seen much faster reformulation in the products which were subjected to the taxation. And also in the same countries, food product, soft drinks, which were not included in the taxation, did not reformulate at the same rate as the food which were part of the taxation. So this has led to reformulation and take tons of sugar out of the food system. That means helping the population to reduce the sugar intake. But we know that sugar-sweetened beverages alone cannot improve healthy diet. Healthy diets require multiple components, as WHO and FAO has published. I'm not going to go one by one. So taxation on SSB alone will not help to improve overall diet. So these are some of the questions we wanted to ask today. How can we use fiscal policies to help improve overall diet based on the lessons we have learned in the SSB taxation, both successes and barriers? One of the main barriers we learn from the SSB taxation is, in the current scenario, we know the cost of living prices. Some politicians do not want to increase taxes on food, which may increase the burden on the consumers. And then, do we have a role to realign our taxes without increasing the overall burden on the consumer, but drive it for a healthier diet? Can we use subsidies? Taxation at different rates? How can we do a tax design to improve overall diet without increasing the overall tax burden? These are some of the questions. Some of our member states has already started changing their VAT rates for healthy foods. In the EU, we know at least several countries. And when those governments were going to do it, the Treasury have contacted the Department of Health and asked for a list of food where VAT should be reduced. And that's when some of those Department of Health contacted WHO. Do we have a scientific good method to produce a list like that where confidently you could share with your treasury? And what kind of scientific method should be available? And this is the dialogue we need to have. What kind of methods are available? How can we test them? How can we make sure they are impactful? I hope today's discussion will take some first steps towards that. And the presentation from Franco and others will give you more insight. Thank you, Melanie. I'll hand over back to you then.
Thank you so much, Kremlin. That was an excellent overview of WHO's policy priorities. So next up, we have today's key presentation on the policy brief itself. Please welcome Professor Franco Sassi, Director of the Centre for Health Economics and Policy Innovation at Imperial Business School, London. Professor Sassi will share key messages from the policy brief on food taxes for a healthy diet. Franco, please take the floor.
Thank you, Melanie, and thank you, Gundo and Kremlin for your excellent remarks, which are a perfect introduction to my presentation now. Let me say, first of all, that it's been a privilege to be able to work with the WHO on this policy brief. I mean, this is a policy area that is of great complexity, but also very important and potentially very beneficial. So I think this policy brief is very timely, and I hope it gets the attention of all the countries in the European region. So my role today is really to provide a brief summary of the rationale and the contents of the policy brief. So I will start from a little bit of background that explains perhaps why we embarked on producing this policy brief in the first place. We all know that when people talk about taxes on diet or what we eat or what we drink, the type of tax that we immediately think of is the taxes on sugar sweetened beverages that have been applied by so many countries in recent years. These are definitely a success story. Sugar sweetened beverage taxes have been beneficial, have produced reformulation, have produced a reduction in the consumption of those beverages where they've been applied, but there is an increasing recognition that these are not sufficient. I mean, if we really want to tackle the health impacts of diets or the contribution that diets today are making to chronic non-communicable diseases, we really need to go beyond sugar sweetened beverage taxes. And taxation is a tool that can be extremely beneficial. It could be applied to food in a way that would produce fairly large health impacts. But as I said before, this is very complex to achieve, and we really need to be aware of all that complexity. And the main reason why this is a complex area for taxation is that essentially every change we produce in someone's diet will have knock-on effects, will produce other changes in people's diet. So it's very naive to think that we can just achieve health benefits by targeting a narrow range of products and just hoping to reduce the consumption of those. People will perhaps reduce the consumption of those, but will likely engage in other changes in their diet, which may or may not be beneficial. The additional reason why this is a complex policy area is that food must remain affordable. And when we think about taxation, clearly there is a risk that taxation might increase the cost of whatever we're taxing. We don't want this to happen, of course. The taxes that we may want to apply to food for health reasons should not just be an add-on to existing taxes. We need to recognize that taxes already exist on food in the vast majority of countries, but unfortunately they're not aligned with nutritional quality. So one point that I'm going to make multiple times in my presentation is that the first thing governments should do is really look into the taxes that they're already applying, even before they think of applying any new taxes on food. So some key principles about food taxes, and these are only touched upon in the brief that we're launching today, but they've been in the making for a long time at WHO. There's been a meeting as far back as 10 years ago in Geneva, a technical expert meeting which I had the privilege to co-chair, which started looking at ways in which we can tax food and in order to improve diet and health outcomes. So those principles have been there for some time in WHO thinking and policy recommendations. So the primary objective, as I say, we shouldn't be naive. I mean, it's not just a question of reducing the consumption of some, foods that are especially unhealthy. The primary objective of food taxation is to shift, dietary intakes from the less healthy foods to the healthier foods in our diet. And in order to do this, we really need to think in terms of relative prices of different foods. It's not just how much people need to pay for food; it's how much people need to pay for certain foods relative to others that really matters. So that principle is very important because it goes along with the need to keep food affordable overall. We don't need to increase the price of food as we try to do, for instance, for tobacco products or alcohol products, because we don't want to reduce consumption of food overall, or at least not to a large extent. I mean, we really want to make people change the types of foods that they're consuming. The other big point that I need to make in terms of setting out the principles of food taxation, because there's been a lot of debate, far too much debate on the types of taxes that should be used or can be used. And this is, of course, a question that governments are grappling with. I want to emphasize that the health tax is defined by the goal of the tax, not by the type of tax instrument that is used. So countries have been using different types of tax instruments for taxing food. Some have been using excise taxes, others have been using VAT or sales taxes, others have been using import duties. There's no right or wrong in this. Countries can use whatever tax instrument they wish to use, and they feel it is appropriate to use. There are pros and cons, however, in each case, and that governments need to be aware of. And these are set out in the policy brief. There's a big table that shows what the differences are between using one or the other instrument, and how each can help to achieve health objectives. There's another point that is extremely important to bear in mind, which we make in the policy brief. Taxes on food can achieve both reductions in consumption for certain items, food items, and reformulation by industry. It depends on how these taxes are designed, and we have seen that very clearly with sugar sweetened beverage taxes, when the UK, I think, was the first one to really try to design a tax that was primarily aimed at incentivizing industry to reformulate. It did it in a way that was different from the taxes that had been applied previously to sugar sweetened beverages. And the UK has been followed by a number of other countries that have, thought that that approach was particularly useful. But we need to be aware that the effects on reformulation and the effects on prices and consumer purchases are not additive. Okay, so people tend to think, oh, well, this tax is going to reduce consumption. And by the way, it's also going to, help or incentivize industry to reformulate, so that is going to provide an extra benefit. No, it's not an extra benefit. So it's either reformulation or price incentives that will lead to reduction. If industry reformulates products, essentially those products are taken off the tax base, and consumers no longer have the price incentive to reduce consumption. So it's either one or the other. I'm not saying that necessarily one is better than the other, but governments need to be aware that either they're achieving a benefit through reformulation, or they're achieving a benefit to reduce consumption, and they need to design the tax in a way that finds an optimum balance between the two incentives, which of course is the one that would maximize the health impact of the tax. There are a number of countries already that are using taxes on food. I mean, the type of approach that we are proposing in this policy brief is slightly different from the way food taxes have been applied. Food taxes for health have been applied in countries at the moment. I mean, there are some countries that are, come closer to the type of approach that is described in this policy brief. But as I say, the majority of countries are using it in different ways. And the main difference being that countries are currently targeting a narrow range of products, and they're targeting a single nutrient or a small group of food products. There are at least 44 countries. I mean, this review was done a few months ago, so it may not be fully up to date now, but based on the GIFNA dataset that WHO compiles, there were 44 countries when we looked into this with 54 tax policies. Unfortunately, the European region is not at the top of this ranking. I mean, it has only 5 countries that are using these taxes. Other regions seem to be using them more extensively. But as I say, if you look at the table on the right-hand side of the slide, you can see that the range of products that are typically taxed is fairly narrow. Do they work? I mean, the question that, of course, governments ask in the first place is, are these taxes useful to improve health, or do they actually do what they're supposed to do? There have been 2 systematic reviews, one of which has been done by my group at Imperial. The first one was done by Tanya Andreeva in support for the guideline that WHO produced recently on the use of taxes on sugar sweetened beverages and food. So these systematic reviews have been very consistent in their findings, and they've all both reached the conclusion that essentially these taxes have produced reductions in the intended reductions in the purchase or sales of the products that have been taxed. Unfortunately, the studies that we've been able to review, the studies that exist, have said very little, have shed very little light on whether these taxes produce substitutions that may actually potentially offset the benefits of reducing the consumption of the tax products. So I would say that this evidence is important, but it's not conclusive, and we need more empirical research, to be able to say that these types of taxes, the types of taxes that have been used so far, which again I would emphasize are very narrow taxes, are really producing an improvement in diets overall. But as I say, what we are proposing is a different type of approach, and we set it out in a number of good practice principles, the way they're defined in the policy brief. I'm going to go through, given that I have limited time for this presentation, I'm going to go through the first two ones and then just list the other four very briefly. So the first good practice principle is that a holistic definition of nutritional quality should be used. So essentially what we're talking about in this policy brief is a broadly based type of tax that would apply across the board to virtually all foods in the food supply in a country. If we want to improve overall diet, that is necessary, and prevent unwarranted substitutions, that is necessary. But if you go down that path, clearly you need a common benchmark that would allow you to assess nutritional quality across all types of foods. We do have these, benchmarks today, and these are nutrient profile models. Essentially, there's been a proliferation of nutrient profile models. Every WHO region has one. Many countries have their own nutrient profile models. So there is a very wide variety of nutrient profile models that can potentially be used to support a food taxation approach. Essentially, we are able to determine the nutritional quality of each food compared to every other food in the food supply, and that would allow governments to establish what foods should be taxed and what should not be taxed, or what foods should be taxed at different levels. Of course, many governments are currently grappling with a much bigger debate, which is the debate on ultra-processed foods, in which nutrient profile models clearly may have a role. Essentially, the debate on ultra-processed foods is generating two types of arguments. On one end, that debate is claiming that reformulation is not useful because even if food products are reformulated by changing their nutrient composition, they may remain ultra-processed because they still contain additives, because they still use types of industrial processing that disrupt the food matrix and may be detrimental to people's health. So reformulation, according to this argument, is not useful. But on the other hand, there is also recognition that most ultra-processed foods are also foods that are high in fat, sugar, and salt, so foods that are typically scoring poorly on nutrient profile models. So there's been a trend towards adapting nutrient profile models to capture ultra-processed foods by adding dimensions in nutrient profile models, like the presence of certain additives that would enable governments to identify what products are not just high in fat, salt, and sugar, but are also ultra-processed. And that, as I say, trend in nutrient profile modeling, I think would be very beneficial in terms of supporting food taxes in the future. The second principle that I want to focus on is that governments always need to start from an assessment of existing food taxes. That is, as I said from the beginning, a very important principle because most countries already apply taxes on food. I mean, these are, clearly general consumption taxes that are applied to most, products and services, and they do apply to food in most instances in most countries. And in many countries, actually, these taxes are applied at different rates on different types of foods. So there is clearly a differentiation of levels of taxation on different foods already. So we propose a 4-step guide. Countries should first of all assess the burden of taxation, of food taxation that is currently borne by households. They should map the burden of taxation to different food products. What products are taxed the most, what the nutritional quality of those products is, are they sold for out-of-home consumption or at-home consumption? So it's very important to understand where that tax burden comes from. And then make a more detailed assessment of the types of taxes that are applied, the extent to which they can be changed, the extent to which new taxes can potentially be added on top of the existing taxes, and then consider the equity dimensions, both in terms of financial distribution of burden of taxation and also health distribution. And then we, move on. As I say, I'm only going to mention these further good practice principles because I don't have time to go in details to them. Incentivize healthy as well as environmentally sustainable food choices. The presenter who is going to talk after me is going to give an example of how health and environmental sustainability objectives can be combined in a taxation system. Follow logical steps. We provide a flowchart in the policy brief that shows what the logical steps are that governments should follow in designing their food taxes. Anticipate and counteract industry imposition. Industry may or may not be opposed very strongly to the type of approach that we are proposing, because of course we're not proposing to raise taxes overall. We're just proposing to reallocate taxes between different types of food products. So there may be winners and losers, but overall industry is not necessarily going to be worse off from the type of approach that we are proposing. And then finally, design and implement a robust monitoring system, which is, of course, an imperative in all instances with food policies. Let me just conclude very briefly with some key messages from what I said so far. So food taxation is a complex policy area that shouldn't be underestimated. Governments should not be naive. If they want to tax food for health, they need to do this very seriously and consider very carefully what the implications of different types of taxes would be. But of course, the imperative of improving diets is so strong and so compelling that we really need to think of this as a very important policy tool to be used in the future. Always start by looking into taxes that already exist and how they're applied. Don't, start by, thinking of new taxes that should be applied. First of all, look at what taxes already exist and see whether you can work within the existing tax envelope instead of applying new taxes. It's very clear from the modeling studies that have been done that these type of approach will not or does not need to increase household expenditure on food. So affordability can be preserved by using this type of taxation, including for low-income households. So that is a very important principle that governments should be aware of, because the criticism that is brought to any tax policy would not apply in this case. They would not increase the cost of food for households. And the benefits, of course, would be much larger for low-income people. I'll stop there. Happy to take questions later on.
Thank you so much, Franco, for that fantastic overview and important insights. Our final presentation now before the panel comes from Clara Garcia-Buisu, postdoc at the University of Copenhagen, who will speak about the role of food taxes in Europe and share some reflections on this publication. So we see your slides, and Clara, the stage is yours. Thank you.
Thank you. Can you hear me well?
Perfectly, thanks.
Great. Yes, so I have been asked to have some reflections on the publication and comment a bit on a recent paper on food taxes. First of all, I of course think it's a sound overview and the general recommendations are sound, and I would say to my taste as emphasized by Franco, like the main point is to evaluate how current fiscal policies are actually supporting or working against dietary recommendations. And I would say it's important as well to take into account, to try to be as accurate as possible when having these fiscal policies. That's why in the policy brief, they recommend having these perhaps these nutrient profile models or the NOVA classification to try to target specific nutrients. However, I think maybe in implementation, this can be a bit more complex, and there is a lot of data needed, and monitoring can become a bit cumbersome, especially taking into account that foods are often intermediate goods, which means that they're often used as ingredients, for example, in the service sector. So tracking these specific ingredients might be cumbersome, but nonetheless will be more accurate. I would emphasize, though it has been emphasized in the publications, maybe even more, that I would concentrate on fiscal policies, and even consider changing the title of the publication and saying fiscal policy for a healthy diet instead of a food tax. And this is because, of course, of these affordability issues that have been already commented by previous speakers. And modeling exercises actually show that having this tax exemption in fruits and vegetables is actually the main aspect driving these positive health effects. And these guidelines in the policy brief also comment on the environmental aspects, and I would even go beyond that and try to design this fiscal policy taking into account the One Health principle, so taking into account the health of people, the health of animals, so also animal welfare and ecosystems health, as all feed into each other. And regarding the opposition, of course, it can come from industry, but it can be a bit more complicated, and I will talk about this later. So I will briefly talk about the publication we released in last January. This work has been led by Professor Markus Springmann and co-authored with Eugenia Dinivitzer, Florian Freund, Jon Daigo Jensen. And in it, we examine how would be a reform in VAT in Europe could be designed, and what would be the effects on health and environmental outcomes. So for that, we actually implement 3 scenarios. The first is like we reduced VAT of fruits and vegetables to a 0 rate. So basically they are exempt from VAT, and then we maximize the VAT on meat and dairy. So each country, we just implement the maximum VAT in each country. And we then have the combined scenario when we have both the increase and the decrease together. And the reason why we choose VAT is actually because food consumption leads to several externalities, both environmental and health externalities. So actually pricing them jointly can be a bit challenging. So we thought that having this VAT reform could be another alternative that could become a bit more feasible, especially for countries that already have this differentiated VAT. So in terms of health outcomes, we observe positive health outcomes, especially from the increase in fruits and vegetables, with 330 averted deaths per million people on average across Europe. And we observe 6% reductions in greenhouse gas emissions and environmental resource use. And we even observe a good economic and tax revenue impacts as tax revenues increase by approximately 0.22% of GDP, while reducing the societal costs associated with health and climate damage by around 0.18% of GDP. So this is the table of the VAT rates we used and how our scenarios changed these VAT rates. And I would like to concentrate on the first column. I'm sorry if these are outdated. So these are the ones we used at the time of the study. Of course, this might have changed in some countries. And we, first of all, observed that it's actually quite common to have differentiated VAT rates. And not in every country, they seem to be aligned with the dietary guidelines. But since there are many countries here, I'm gonna focus in few of them. the overall result we observe, and I commented before, is these positive environmental impacts that are mainly linked to the consumption, to reduced consumption of meat and dairy in the first panel, in the panel A. And the health impact, as I mentioned before, the positive health outcomes mainly come from the increased consumption on fruits and vegetables. Overall, the change in the cost of diet is quite small, and we observe increases in cost savings because of increases in tax revenue in the case of the meat and dairy tax, or decreases in health costs in the case of fruit and vegetable exemption. So I said that I would like to concentrate in some countries. The reason why I picked these countries is because Hungary and Spain are going to be after represented in the panel, and then I work in Denmark, so I come from a Danish university. So I think it's interesting to first look at the national dietary guidelines in these countries. In the case of Denmark and Spain, they have been recently updated to also take into account environmental aspects. So they have recommendations for the decrease in meat, especially red meat consumption, and limits to the dairy consumption. In the case of Hungary, this is not still the case, but the three dietary guidelines, of course, recommend a high intake of fruits and vegetables. But what is the reality? So I picked some numbers. Of course, this is not a thorough review, but it's just to give an idea. In the case of Denmark, the VAT, it's uniform, so for, both fruits and vegetables and meat and dairy have this 25% VAT. In the case of Hungary, they have differentiated VATs, and some meat products and dairy products have reduced rates, which means that fruits and vegetables are submitted to a 27% VAT, while meat and dairy products is 7.9%. This is an average. And in the case of Spain, they also have differentiated VAT, and actually they go quite in detail in the different food products. But when we look at the fruit and vegetables versus meat and dairy, we observe that it's more or less is quite similar. These countries also have some excise taxes. In the case of Denmark, it's sugar-based, sweet chocolate, but actually it has been announced that it will be repealed. And Denmark also had, I think it was in 2011, a fat tax, a saturated fat tax, that was repealed. I think it lasted over around 12 months, a bit less. In the case of Hungary, they have an excise tax in foods with high sugar, salt, and others. And Spain is actually using this differentiated VAT to tax more SSP, as recommended by the WHO. So how are the intake or the diets of these countries look like, given taking into account the dietary recommendations we saw before? In the case of Denmark, only 23% of population eat 5 or more portions of fruit and vegetables, and this is even less in the case of Spain and Hungary. And in the case of the meat consumption, all of the countries basically exceed the maximum recommended meat consumption, and we observe rates of overweight and obesity of around 50% in all the countries. And when looking at household affordability of food, we observe that Denmark is 3% of families that cannot afford food, proper food, and in the case of Hungary and Spain, these numbers are larger. And this is why I would especially emphasize the need of tax exemptions and subsidies, because we know that lower income families actually devote a higher share of their budget to food consumption. So not to make it, we need to make these healthy diets affordable to them. And as we've seen before in our study, the main health positive effects come from this exemption from fruits and vegetables. So I said before that I will comment in some opposition examples. I think you have a good review of this, why this Danish tax on saturated fat did not survive in this paper. And we have some recent examples about how the industry can actually throw PR campaigns against even dietary guidelines, as the Eat Lancet report. We also have miscommunications or miscoordination within government. So this was before Spain released these new dietary guidelines, but still, like, there was like some misalignments between the Prime Minister and the Minister of Consumer Affairs. So having these alignments is actually also important to promote these healthy diets. And recently, we've seen how Denmark is actually planning on removing this excise tax, even though these their dietary guidelines, of course, try to minimize the consumption of these kind of foods. So finally, I will just go through some final reflections. From our study, we observed that targeted VAT adjustments can significantly shift dietary patterns toward healthier and more sustainable choices. The countries that already have differentiated VAT for food products should align them to the dietary guidelines, as currently they, in some cases, seem to be working against the dietary guidelines. Other countries could consider both a combination of subsidies or tax exemptions together with excise taxes in specific food groups. Then from our study, we learned that lowering VAT on nutritious foods like fruit and vegetables delivers major health benefits, and raising the VAT on high environmental impact foods like meat and dairy amplifies environmental gains and impacts positively in government revenue. So we claim that a combined VAT reform aligns public health, environmental sustainability, and fiscal policy. And these were my points for today. I'm happy to answer some questions later.
Thank you so much, Clara, for those really important reflections. So we will now move into the panel discussion, which will be moderated by Kremlin Wickramasinghe. So Kremlin, please take it from here.
Okay, thank you, Melanie. Thank you very much, and a warm welcome to all our panelists who are going to join us for the next section of this webinar to be with us and answer some questions. And also thanks to all the speakers who spoke so far. So I'll introduce each panelist as we go. First, I think, Franco, I'll come to you last to give some overall reflections. We have some questions in the chat. I'll try to take them as much as I can to the panelists. But we would like to hear first from our panelists. How do they find for their work this policy brief? What do they feel? How can it help their work? But also, what else from this audience would you ask? We have researchers, we have public health experts, academics, NGOs, businesses. It's a public webinar. People are interested on this topic. What additional information would you like to have to advance this dialogue in a meaningful way? So with these broad questions, maybe I can first go to Christina Biro, who's the Head of Unit, Ministry of Interior, State Secretariat for Health at the Department for Health Policy in Hungary. Hungary's name was mentioned already a couple of times because you have a tax, and European countries are looking up to your tax and what we can learn from you. Christina, floor is yours, and thank you.
Good morning, everyone. Thank you, Kremlin. Thank you all. I'm happy to be here and to have the opportunity to share with you some of our experiences. First of all, just very briefly on the Hungarian tax, and then I will come back to your questions, Kremlin, and the comment. The Hungarian Parliament has approved the Hungarian Public Health Product Tax in 2011, and that was really a long time ago, almost 15 years ago. And that time, globally, there have been only just a few examples, good examples for taxing on healthy foodstuffs. So for us, the success, one of the key factors was the high political will and the high political commitment that just created a kind of good environment, and for an atmosphere for approving the tax and accepting the tax. Also, there was a big public demand and a big public pressure, and also pressure or demand from the professional side and from the public health experts. But the political will was a very important key factor that is still actually there. So we have seen some examples where the tax was withdrawn, and we are very happy that Hungary could still keep this food tax. We had some impact assessments also carried out in cooperation with WHO along the last 15 years, which proved also that this food tax can be a very good fiscal instrument that can be a very effective tool that can play a good role in improving health, nutrition behavior, and the nutrition literacy, and the consumer behaviors changes have been also approved in Hungary already in the impact assessments. And of course, we had this direct effect that we could measure already in the impact assessments, but also indirectly, this tool was this tax was also a very good alternative financial mechanism for the health sector, and we could roll back, the money that was gained also into public health interventions and initiatives. That was also an indirect effect that could help us to improve our health status and parameters in Hungary. However, which I would like really to important is really for those who are introducing the tax or thinking about to introduce a tax, it's very important to see that it's not a silver bullet that could help, and just to improve your health status in your country and the nutritional status. It has to be one element, in a complex set of initiatives, and also the Hungarian government has recognized this because this was an element besides others like the food, the trans fatty acid legislation that we have introduced, the third country in the European region in 2013, or the the daily physical activity, which was mandatorily requested for schools for children, or the public catering act that we have introduced. So it has to be seen in a holistic way and in a comprehensive approach. So it really has to be also accompanied with other elements, just like what was mentioned, like the decrease in the VATs, for special food categories, which are part of the healthy option. Like in Hungary, we also have, besides those that have been mentioned in the previous lecture, not just the meat and dairy products, but also fish. The VAT for fish products is decreased recently, and fruit and vegetable products. We have the school fruit system, which Hungary is part of the school fruit system, and we try to use other incentives also besides the food tax to help also those who are in low social economic status and who are really affected quite largely by the tax. What I would like to just coming back to your questions, Kremlin. I think this policy brief can be useful for those who are just planning to introduce a food tax, who are not familiar with the tax at all. So far, it's good to see, the most important principles that they have to actually consider, when they want to design a well-constructed tax, because the environment, the food environment, the legal environment has been changed so far, in the last decade or the 20-15 years since we have introduced our tax. So we also need to a little bit refine the tax, and consider, One Health approach, One Health principles, the sustainability issues, environmental issues. So it's really, now it's giving a kind of overview, what kind of current principles they have to consider when they want to introduce a new tax. But also for us who are having the tax already for a few years, many or less years, it's good to see what is actually the guidance, according to which we have to review our tax, because there are so many other aspects and new aspects have been coming up and raised up in the last years. So for us, it's also good to see follow the 4-step guide that has been mentioned by Professor Sassi, to review and to revisit our taxes. But I would like to emphasize the monitoring and the regular reviews. It's also written or included in your policy brief that it's so important to do, just to demonstrate the impacts, some measurable impacts. But what I would like to say, what we have experienced in Hungary, we included many health economists also in the impact assessment, so they really have to be there. And we assess also the performance of the food industry. And I think it's very important because they claim many things, they really give a big resistance. They claim many things, that they had to close factories, they had to fire employees, so we have to check their performance as well during the impact assessment. So within the framework of the impact assessments, their net profit, the number of employees, the tax rates changes. So we have also assessed these performance indicators for the food industry, and we could use the results, the outcomes in the argument with the food industry and also in the public arguments, because they were not actually complying with the claims that they use in the argument to withdraw the taxes. So I think we can also, it's an important part to also monitor their performance, and just to use the results in the argument for the debates when they want to withdraw or when they want to prove that the food taxes are not effective at all. So that's all from now for the moment. Thank you very much.
Thank you, Christina. Very insightful. I think throughout the presentations also, we mentioned, and there was a question that SSB taxation may not have reduced obesity. As we all know, one tool, one policy will not address obesity or improve diet. If you look at the causes of obesity, there's more than 100 causes, and this is one element. But it needs a very important element of the puzzle that we need to implement all of them in order to make a change. But thank you for making those points, and also about the need for continuous monitoring and evaluation in the changing priorities and context in health, but also in other areas like environment. Thank you for that. And thank you to Hungary for joining us. Next, we have another member state today with us, that's Spain. So it's my great pleasure to give the floor now to Almudena Roland, who's the Deputy Director General for Nutrition at the Spanish Food Safety and Nutrition Agency. Their team has also reviewed this when we're developing. So Almudena, I want to thank you for the collaboration from Spain, and the floor is over to you.
Thank you very much, and good morning, everybody. In Spain, we have a limited experience in the use of food tax. Is restricted to the tax on soft drinks and beverage with added sugar or artificial sweeteners. And in addition, during the economical crisis, the government reduced the VAT for some essential food to zero, but it was a limit measure. We think this policy brief is very, very useful to understand the importance of adequate design and of this kind of measures, and we think this can help other agents outside the health sector to understand and to support this kind of measure that can be very, very controversial, because it can be a lecture that is not right when we try to implement this kind of initiatives. For that, the importance of taking a comprehensive approach to incentivize and subsidize the essential foods and healthy foods. We share with the authors the idea of the benefits of a holistic approach based on a nutrient profile model, but we think that there are important challenges in the design and monitoring of a task system based on that model, because we think we lack of public and accurate data to design and especially monitoring this kind of model. For instance, we do not have public data on food composition or food sales for pre-packed food, for instance. So if we design a model based on nutrient profile, on the nutrient composition, I think we would not be able to assess if the tax is really promoting healthy options against the other one. So in that way, the help of international experts to identify good sources of information is essential from the very beginning to really have the right information for the design and also for the monitoring of this kind of measures. Now we are working in a report to assess the impact in Spain of the different taxes on soft drinks, and we will happy to share with you the conclusion of this report in the near future. Thank you very much.
Thank you, and also the challenges with data to monitor and evaluate policies, not just the taxation policy, even other policies, is a major challenge in this era of science, not having the right public data to evaluate and have a good debate. Thank you for highlighting that to Spain, and we hope to come back to you with other questions later in the day. Next, we have Dr. Koting Eklep. He's a scientific coordinator of the Joint Action for Preventing CDs, but also representing the Norwegian Institute of Public Health. Kutingi, I hope you will be able to give a brief overview of what the joint action as the largest EU member states coming together for prevention of NCDs. And how is this topic, the fiscal policies and taxation, is it important for the joint actions, and how well your member states and project is focusing on this topic? We wanted to hear from you. Floor is yours, and thank you for joining today.
Thank you very much, Kremlin. And first of all, congratulations on this, I think, impressive and timely and very useful policy brief. In particular, I think it is highly valuable how this brief outlines the various policy options that governments have when planning and implementing tax designed to promote healthy diets. And I also find it important that it so clearly underlines the need to look at and redesign existing taxes on food without necessarily requiring new taxes, and also without increasing the overall burden on food. In the joint action project Prevent NCD, where we have as many as 25 participating countries from Europe, we do see that food taxes is a much debated topic among the member states. And as pointed to in the brief, several countries have experience with various forms of taxes, but some European countries, including my own Norway, have repealed them. In Norway, we actually had 2 sugar taxes dating back to the 1920s that were repealed about 4 years ago. And increased cross-border trade is one argument used by industry against such taxes, claiming loss of local business, revenues, workplaces in the countries that has the tax. And this was very much so the case in Norway. Those were the main arguments that were put forward by the industry and led to this cancel of these taxes. And so while these in part might be vicarious arguments, I think these are also very important arguments for us to address. Another concern often raised is the differential effect such taxes might have on different socioeconomic groups, as it is often portrayed as an additional strain on the economy of low-income groups. But as we've heard, several of the speakers have already addressed that argument. But within our project Prevent NCD, then we have a strong focus on health taxes and how to improve them and expand the scope. And activities include learning from experience across Europe by reviewing current both EU taxation directives and national taxation policies, and then in particular to identify strengths, weaknesses, and best practices based on prior evaluation of the impact of these directives and policies. Also, with the assistance of the Imperial Business School in London, create data and modeling infrastructure to support EU and country efforts in the design and implementation of new fiscal policies, and also to run simulation of tax policy developments in selected countries. We also address cross-border trade and issues related to the health taxes. In all of this work, we have special attention on how vulnerable groups, including low socioeconomic groups, are affected and also benefit from health taxes. And in this work, we are very eager to continue the very productive collaboration we have with WHO, and also, as mentioned, with Imperial Business School and Franco Sassi as a subcontractor to our project. So thank you very much. Back to you, Kremlin.
Thank you, Kutingi. Thank you so much. And we also look forward to benefiting from the work that you are doing with Imperial on those modeling studies and others. So thank you for alerting us about what's upcoming from the Joint Action Project. Next, it's my great pleasure maybe to give the floor to EuroHealthNet. Today, we have Dorota Snukovic representing EuroHealthNet. She's a senior policy expert and joining us today. Dorota, over to you for your reflections and how this fits with your agenda of the EuroHealthNet as well.
Yes, thank you very much, Kremlin. I am pleased to have been invited and indeed speak on behalf of EuroHealthNet today. And just like everybody else, first of all, let me congratulate you and the team on publishing this timely and really strategic brief, and more generally, actually, on standing steady and being visible and available and moving forward on the NCD's prevention front. So thank you so much already at the beginning. How we see it. So For EuroHealthNet, the fiscal measures, we agree with it, are among the most effective levers the governments have to shape the transformation of healthier food environments. And in the current context of the cost of living pressures and persistent and often widening inequalities in health related to diets, they, and the brief presents it really, really clearly, they can support making healthier options more affordable, price-wise, more economically attractive and accessible, while discouraging the purchase and overconsumption of relatively cheaper and harmful products that we know the households on low income and in more deprived communities are the biggest consumers of and negatively affected by. So how we see this brief and in general the fiscal measures here, we see them as not just a standalone health or fiscal tool, but actually also as instruments of equity and social measures. So the social inclusion, helping to reduce diet-related inequalities, prevent costly NCDs that then drain the costs from other, let's say, social objectives, and strengthen individuals and communities' resilience. This brief matters for us because, as I already said, it offers practical, evidence-informed options, step-by-step considerations to make any interested or not yet convinced, let's say, policymaker wise, let's say, choices. And it's very important at the time of intense EU health and social policy activities. So it comes really, really timely. We see the first EU cardiovascular health action plan being produced. And from our side, for example, we urged and encouraged the plan to see the fiscal measures being included as part of the package. We also work on many social inclusion and social objectives related EU agendas. The new European Pillar of Social Rights Action Plan is coming up, EU anti-poverty strategy, and we really put a focus also on looking into utilizing fiscal measures, for example, for more affordable and healthier diets as part of these works. So if used strategically, these solutions can make it a mainstream economic and social policy toolkit. And ideally, we would like it to be seen also and pave a way toward an EU-level approach, the least as encouragement and inclusion in a broader package of NCDs prevention measures. So not as a kind of standalone single silver bullet solution, but as a part of a bigger package that all EU member states in the European region can be pointed toward. And I wanted to add here, it also comes very timely and strategically in the current climate at the EU policy stage, which are, and I guess this is not going to be seen as a kind of surprise, is not really in favor of regulatory approaches. And in fact, we are amidst a deep regulatory wave in Europe. See, for example, what happened to the Farm to Fork strategy, the EU framework for sustainable food systems. So this is really coming up at the time with really evidence-informed messages and presenting options that can be explored by member states. Just very quickly, I have a few themes in terms of maybe not evidence gaps, but what we would see this brief could kind of highlight better, or where we can actually take it forward. So number one, presenting distributional impact, so the equity proofing of the evidence. So information on who the fiscal measures on foods for healthier diets benefit. So the data question was already mentioned, how food taxes affect different income groups, age groups, and regions to showcase the proportionate and faster effect. Perhaps stronger modeling and real-world evaluations of how the regressive effects can be offset, and the subsidies, vouchers, etc. were also mentioned. So perhaps a kind of highlighting that better would be quite appealing to policymakers. And showing it also like combined policy effects. So how the evidence on health taxes interacts with other measures, the subsidies, marketing restrictions, front of pack labeling, school meals, that was also mentioned, but we think it could be kind of presented better a little bit as a kind of storytelling way, because policymakers want clarity. You know, are food taxes more effective alone or as a part of a package, under what conditions, what to do with the administrative burdens, etc., etc. And last but not least, and that will be my last point, and it was also presented in the presentations, positioning it as part of a wider co-benefits beyond just the health outcomes. So stronger integration of evidence on environmental and climate in relation to these measures, and links to social outcomes such as poverty reduction, intergenerational fairness, productivity gain or loss, and education. And it's really, really important in the context of the cost of living crisis, food insecurity, and problems with food affordability. And maybe just for me to finish with it, this is all great, and my understanding, this is for policymakers, but kind of quite a wider group of stakeholders. For these measures to succeed, what we think, or I think, that the public health workforce must be equipped better to design, advocate for, communicate the benefits. So perhaps that could kind of enter more the public health workforce competence frameworks that I also know WHO is working on. So this might be crucial, and to ensure that it's really well thought and designed. And EuroHealthNet, so on our side, we are happy and standing ready to support your work and with our partnership and members. So thank you very much.
Thank you, Dorota. Yes, I think many of these policies require better communication about the overall benefits and not just gathering evidence. So I think all of our public health competencies in communicating that with multiple stakeholders is important. Everything we could do to build that capacity is valuable. Thank you for bringing that point. We'll be very happy to work with you on that. We go to our final panelist for today, Camille Perrin. She's from the EU Food Policy Coalition as the coordinator. Camille, thank you for listening to all the speakers patiently. Floor is yours now for your reflections. Thank you.
Thank you very much. Good morning or good afternoon, and thank you very much for the invitation. The EU Food Policy Coalition is a platform that represents 63 organizations, including NGOs from a broad spectrum, such as environmental, consumer, public health organizations, but also grassroots social movements, peasant farmer organizations. And we provide a space to facilitate coordination and convergence between these organizations to advocate together for sustainable food systems in the EU. And that includes driving a transition to sustainable healthy diets by creating enabling food environments. And indeed, part of our collective work is about changing the narrative around diets and consumer food choices. It is often claimed by industry, but also by many policymakers, that dietary trends are driven mostly by consumers' preferences, personal preferences. But evidence is in fact accumulating that people's food choices are strongly shaped by what food is available, how much it costs, the information that is provided to consumers through labeling and marketing. And so rather than blaming consumers for making the wrong choices, we believe that policymakers need to make it easy for them to choose food that contribute to healthy and sustainable diets. And obviously price is a major factor determining people's food choices, if not the most important one, in fact. And when asked about what would help them adopt healthier and more sustainable diets, Europeans most commonly reply that this would be by making healthy and sustainable food affordable. The problem is, as rightly recognized in the policy brief, that today food prices do not reflect the true costs in terms of the impact on health and the environment. And this is despite 8 in 10 Europeans agreeing that food prices should reflect the true cost for society. Today, the healthy and sustainable choice is most often the cheapest option. And so we think that indeed changing the relative price of less versus more healthy and sustainable food
could contribute to better reflecting the true costs and as such to steering consumers towards more sustainable and healthier choices. We see the policy brief as rather timely because echoing Dorota, I wanted to refer to a forthcoming initiative by the European Commission, which is the EU Action Plan on Cardiovascular Health. And we know that cardiovascular health is the #1 killer in the EU, and the economic costs is also staggering. And unhealthy diets are one of the leading risk factors, yet preventable risk factors for cardiovascular disease. And therefore, the policy brief can certainly inform the debate around this action plan. However, we also see some points of attention for governments when considering introducing fiscal measures on food. And I will also echo some of what has been said already by previous speakers. The first point is fairness and distributional impact. It's been discussed already that food prices have increased quite significantly over the past year in the EU and beyond. And this has exacerbated nutrition inequalities. Affordability of food is a growing concern for lower income households. And again, as has been said by previous speakers, just increasing the price of less healthy, less sustainable food will not work. Governments also need to make healthy, sustainable food more affordable. And they also need to introduce compensation mechanism to avoid adverse effects on lower income households. And there we see a role for research to inform on the type of mechanism that work best. For instance, some speakers have mentioned VAT, but we've seen some countries lowering VAT on fruit and vegetables, for instance. But the price cut has not always reached consumers because in some countries, retailers have pocketed the money. So we need to also look underground, because something that can work in theory, maybe underground will not have the same effect. The second point is public acceptability. We know that public acceptability around fiscal policies is complex. Industries also knows it and can exploit it. So to help overcome the fear of political backlash that can perhaps constrain certain governments, research could investigate the conditions for public acceptability, looking at the experience of countries that have successfully introduced such fiscal policies. For instance, is a levy better accepted than a consumer-facing tax, for instance, or how to avoid industry interference, how to communicate around the measure to the public to improve acceptability. And the third point is policy coherence, because again, echoing what Dorota said, can fiscal measures be fully effective when at the same time farm subsidies continue to incentivize the production of less healthy, less sustainable food? And what about the impact of price strategies and promotions by commercial actors, thinking of retailers' promotional offers, but also the way they price the different foods in the supermarket? So there is a risk that these other policies or practices could mitigate, if not offset, the effect of fiscal measures on food. So we have also to keep this in mind. And my take-home message would be, again, fully in agreement with what has been said, that when considered, fiscal policies on food can only be part of a broader set of policies to transform the food environment, because in the end, this is really what will help consumers to change their food choices. Thank you.
Thank you, Camille. We have a few more minutes. I'll take at least a couple of questions from our Q&A. Maybe Carla, if you are still with us, I think this question is from Anna Consavaya. She says, dear colleagues, the food taxes which are definitely need to be implemented, such as SP tax, fast food. But here we discuss some tax, for example, meat and dairy, which are not so obvious. For example, unprocessed meat consumption or low-fat dairy products in some countries are associated with improved survival, especially low and middle-income countries, even in some of the WHO European region countries. Maybe here recommendations have to be differentiated and adjust to the context. I think, Carla, the main point you said was this needs to be aligned with the national food and dietary guidelines, right, in each country. And hopefully each country's national food and dietary guideline will know whether meat consumption needs to be reduced or increase the benefits, hopefully. But over to you, Carla, for reflection.
Yes, and I think mainly we wanted to take into account both environmental aspects and health aspects. So it's true that our choice of food groups is quite aggregated. We try to simplify a bit our scenario, so that's one of the reasons. But of course, in the case of a greenhouse gas tax, also it would be different depending on the types of meats we're talking about. So this was a bit a way of simplifying things, and probably it should be more detailed in case if it wanted to be implemented.
Thank you. Franco, I hope this question, you or any other panelists can please come in. It says, this is a question from Isabel. Behavior change usually works more with positive incentive. Do you have an example, an impact assessment, where industry was provided a positive incentive to develop a more healthy portfolio? What would be your point of view on this?
Well, the positive incentives might be built into the type of taxation approach that we have described in the policy brief, because there would be tax reductions in some instances, which would be equivalent to a subsidy or a positive incentive. So there may be positive incentives in this system, but of course that touches upon a broader issue, which is how we work with industry, with the food industry in this case. I mean, of course, the food industry is different. You could argue from the tobacco and alcohol industry, for instance, which can be kept at a distance in policy making. The food industry is, somewhat more essential to, the production of goods that people will always consume, will always have to consume. So clearly, the approach to the food industry in designing taxation should probably be different in this case. Again, I mean, the sugar-sweetened beverage tax in the UK has been a very good example. That was a policy area in which there was a willingness on the part of industry to reformulate. There was a solution, a technical solution, which was non-sugar sweeteners, which now we know is not ideal, but at the time when the tax was devised, seemed to be a good solution, and that led to a successful outcome. In the case of food, there may be instances, there would be instances in which a similar situation can be reproduced. So it's for governments to work with specific components of the food industry to achieve the same type of outcome as it has been achieved in at the time in the UK. This is possible. It's just a question, for governments to commit to approaching industry in a way that would be conducive to achieving the goals that government wants, and not necessarily the ones of profit maximization that industry wants.
Thank you, Franco. I think you mentioned UK, Portugal also first had a one-tier tax, and then later at the revision, they made several tiers, so industry could regularly bring different groups below those tax thresholds. So it's a positively reinforcing them to reduce sugar and make it achievable as well. We have several such examples. Thank you. Carla, maybe very quick reply to this. How would you recommend taxing high health risk but low environmental impact food? Probably this is the health and the environmental balance, right? And what is your quick reaction to that? How do we differentiate or balance these things?
So I think that is exactly why we propose this VAT aspect, because I think it's actually very hard. Because, I mean, in economics, we always think like we need to price things optimally, right? Like if you have an externality, you find the cost of this externality and you price it appropriately. The problem is when you have these interactions, it's quite hard. And I think, honestly, at the end it's a political decision. So I'm an academic and I can provide the best advice in base of what we can model. So I would say I don't want to comment much more because I actually think it's a quite political decision.
Thank you. Albertina, have you thought about that? We have a calls to implement more sustainable diets, but more healthy diets. How do you strike the balance if we think about fiscal policies within the health and sustainability? Spain or Hungary, would you like to comment on that? Any things that you have considered? Any of you?
Yes, we agree that all of these aspects have to be taken into account, but the complexity is bigger and bigger when we put more factors in the model.
Yeah, thank you. Franco, maybe it's time to close the session. So I want to thank all our panel and all the speakers. It was a wonderful 90 minutes bringing this. You have the link in the Q&A and it's on our website now for the fact sheet. It's live. I hope you'll be able to find it. And our social media will also share it later today on WHO corporate channels. Thank you all. And Franco, do you have any final words from my side? Thank you very much to all the authors, all the participants today. And from WHO, I want to thank my colleagues who work on this, especially Claire Farron, Julian Williams, and then Namin and Elena Tokareva, our moderator, Melanie Nichols, but also for IT support from Aran, and also for the admin support from Alexandra, and all the participants who join us, more than 350 we had at the opening. Franco, over to you for any final words.
Yeah, just very quickly. Well, first of all, I join you in thanking all the colleagues for this fantastic webinar. The comments that were made are really relevant and important. I just want to emphasize that all of the concerns that people have brought up in the discussion, be it from a government perspective, from a consumer perspective, and so on, are concerns that can be addressed in the framework that we have set out in this policy brief. So they're all legitimate concerns, very valid and important, but they can be addressed in that kind of framework. So I hope governments would be willing to make the effort to tackle the complexity of these difficult policy area, because the rewards would be great if they do it.
Thank you all. A wonderful Friday and a weekend ahead. Thank you. Goodbye.
Thank you.